Hey, Miss Jones. My name is Brooke. I'll be your nurse today, and we're going to be inserting an ENG tube in you. Can you tell me your name and date of birth? Okay. Do you have any allergies? Okay. So she said she has no allergies. I've already checked doctor's orders. She's supposed to be getting it. It's all good. I'm going to go ahead and raise you in high Fowler's position. I've already gathered all my equipment. I've checked the expiration date on my packaging. It's not out of date. It's good. I'm going to perform hand hygiene. Put my gloves on. Let me go ahead and get my stuff ready. I'm laid out here. Okay, Miss Jones, can you tell me which nair is more patent? So she said her right nair is more open, so we're going to use her right nair. I'm going to go ahead and wipe it off using a alcohol fret pad. Go ahead and drape her. I'm going to get my tubing, and if you have a Salem sump or a dual lumen tube, the air vent has to go above the stomach. So I'm going to use a measure using the next method from the nair to the earlobe to the xiphoid process. I'm going to mark it using a permanent marker. I'm going to go ahead and place the tip in 2 to 4 inches of lube. Okay, Miss Jones, I'm going to give you your cup of water with a straw, and I'm going to have you, whenever I'm inserting the tube, I'm going to have you tilt your head back against the pillow. And once I reach your gag reflex, I want you to tilt your head forward and take drinks of your water and swallow as I advance the tube down your throat, okay? I'm going to get my tubing. Okay, tilt your head back for me, Miss Jones. Tilt her head back. Okay, so I've reached your gag reflex. I want you to tilt your head forward and swallow, swallow, swallow. Keep swallowing for me. And I've reached my mark. If she had any signs of distress like coughing, cyanosis, gasping, or inability to speak, probably in her lungs, so I need to discontinue the tube. I'm going to go ahead and secure it. She probably already has a chest x-ray ordered, so we're just waiting on that to confirm placement. And another way we can confirm placement is to check her stomach content. So I'm going to pull this out. I'm going to take your water from you and put it over here because you're done with it. Aspirate. Put this above her head. I'm going to document the color, odor, and consistency of the stomach content. I'm going to get my pH strip. I'm going to put some on the pH test area. I'm going to read it within 30 seconds. If it's supposed to be acidic, so anything less than 5.5, but if it's like 4.0 to 6.0. She's probably on acid inhibiting agents. Hers is 5.5, so I'm going to document that. Now that we know that it's in the right place, that she's good, she's had a chest x-ray, all that, I'm going to go ahead and measure it from the end of the nair to the end of this clear piece, not this one, but this one, in centimeters. Okay, so it's 72 inches of the tube that's left out, or 72 centimeters of the tube that's left out, not inches, sorry. And I'm going to document that as well. Now that it's in the right place, we know how much is left out, we can secure it with a piece of tape, more secure device. Go ahead and hook it to suctions or tube fittings as ordered, and before getting anything, I would check the stomach content and measure the tubing and stuff to make sure it's in place. You know, get to check the chest x-ray, all that, if something was to happen. Like if I couldn't aspirate any stomach content out of the tubing, or the measurement had changed, I would contact the PCP, and maybe they could get like an x-ray and check their chest x-ray and check the tubing per hospital policy. And if she wasn't getting anything, I would still come back and every 4 hours and check the stomach content and stuff, checking the placement using two methods, so like the stomach content and the measurement. And after feedings and after giving medication, I would come back 1 hour after to check the stomach content again. And you're going to check it anytime before you give anything through the tube. And I would provide nasal and lubricate the nairs and the lips as needed, and provide oral hygiene as needed too. I'm gonna take my gloves off. I'm gonna clean up my area and dispose of all my equipment. I'll leave her up. She's hooked to feeding or suction. I'm gonna give her a call light. Miss Jones, do you need anything? If she doesn't need anything, her bed's locked and lowered. She's good to go. I'll perform hand hygiene, report and record.